All right, good afternoon, y'all. Can you hear me? Okay, so we'll go ahead and get through our COVID sit report. Hope you guys are doing well today. So go ahead and start. Our 14-day positivity rate here at Winslow Healthcare Center is 8.54%. Out of that is 45 who are positive out of our 527 who were tested. So these is all throughout the 14 days, and some of them are not active cases, but some of them are. So just keep that in mind. It did kind of go up, which is why I put it in orange. Not too much. It's just a slight increase. And as you can see, I put a visual of our COVID-19 positive tests by day. Is it too noisy? Or is it okay? Okay. So yeah, and you can see we're at the end here at the under our dotted our dashed rectangle. It is going lower, so that is good there. And then here is our COVID mitigation practices that we abide by. It's the getting vaccinated, getting boosted, and encouraging others to get vaccinated, as well as practicing proper hand hygiene, and properly washing your hands and sanitizing hands regularly, being mindful of social gatherings, avoiding large gatherings, and keeping the spread of COVID-19 low, and wearing a mask in public indoor spaces as much as you can, and staying home if symptomatic. Having a runny nose or a cough, might not just be allergies. So we do encourage you guys to get tested if you become symptomatic. And here is our school health roadside banners that we have. Also encouraging if your child is sick or has any symptoms, getting them tested or staying home just to stop the spread of COVID-19. And then our National Childhood Obesity Awareness Month events is happening this month. We are on our last event happening next week on the 27th, which is Tuesday. It starts from 4 p.m. Mountain Standard Time to 5 p.m. Mountain Standard Time, or the health fair starts at 4 p.m. and then the 2-mile run walk happens at 5 p.m. Mountain Standard Time. And we have various activities, health booths, brief presentations. We have diabetes and A1 screening in our mobile unit. And then we have a lot of great incentives, a lot of school supplies, and our first 50 participants receive a really nice shirt that we made, our youth wellness shirt. So here is kind of a recap of some photos that I've taken throughout the events. Unfortunately, I wasn't able to make the White Cone chapter event, so I don't have any pictures from there. But as you can see, we've had some families come out and participating in the health booths and getting their fun incentives there. And then here we have our family health night. So this is coordinated by our school health coordinator, and her name's Luana. So this is kind of new. In our next event, or our first event, is October 27th. We have interactive, fun, educational presentations and health booths for the whole family, as well as they are personalized for each school. I know she sent out kind of like a survey of what most topics that you guys would like to have at each school. So it is personalized for each school, and refreshments and snacks are provided in partnership between WIC and schools. So we do want our schools to be involved with this as well. And if you have any questions, or if you want to, get it started, I know some of us, our schools are still trying to set a date, a solid date. So I'd contact Luana Winslow, our school health coordinator, if you have any more questions on that. So our first one would be at Jedito Public School, starting at 5 p.m., 7 p.m. And then as well, our next one would be at November 15th at Delcon. So these are solid. So we're waiting for these schools. Um, and here's just kind of our Ojogga Ina Wellness Center group fitness calendar. Just a reminder that we do still have these group fitness classes. So our next class is tomorrow. Step with Terry here at the parking lot east of the Wellness Center. It starts at 5:15 p.m. So come on and sign up. We do encourage you to arrive 15 to 20 minutes early if you have not updated or filled out your HIWC waiver form. So we do have those still. And then just a reminder for our older population here, men and women ages 45, we do recommend for screening for colon cancer screening. And we do have our patient navigator here for that. So it's just kind of a reminder having this in there. And then our newsletter is out. Our Yacht Ed newsletter, the summer edition, is out. So you might see them at your local chapter houses, gas stations, select gas stations, and convenience stores, and also online. So yeah, that's out there. Thank you guys. If you have any questions, go ahead and ask them.
All right, thank you, Tyree, for that update. Does anyone have any questions based on the information that she shared? Any questions? Okay.
Sasha, I realized I forgot to say the testing drive-through hours.
Okay, go ahead.
Okay, let me put that back on the screen. So I forgot to say this on the first slide. We still do have our testing drive-through here at WIC Monday through Friday, 8:30 a.m. to 4 p.m. And we are closed for lunch from 12 to 12:45 p.m. As well, it's the same time for our vaccine clinic as well. Monday through Friday, 8:30 a.m. to 4 p.m. Also closed 12 to 12:45 p.m. for lunch. And our testing is still a drive-through. So if you need to get tested, come on through to our drive-through. And then our vaccine clinic is located in the MOB, not through the main entrance, but on the side entrance, just a couple feet to the right. So I forgot to update on that as well. Thanks.
Thank you. All right, let me go ahead and share my screen here. And start off with the PowerPoint. So you can see my screen okay. So just the update here, I'm still keeping track of the school aged cases. So whenever we get a positive case and I am notified of which school they attend, and I am still emailing the school notification. So if you see an email that says secure, it's important to open that up right away. And it'll tell you if anyone of your students had tested positive and they were tested here. Sometimes they were tested at like LCMC or Hope E Healthcare Center or another site, and we end up receiving the referral from those other sites. And so sometimes it might seem a little delayed, but we do still try to get you that information just to confirm the information that they have tested positive. And we usually try to supply the positive test date and also the date symptoms started, so that you can go according to your school's protocol and determine what day the student should return to school. So this is what we have so far from the start of school week in July 31st to the week of September 11th, which that week ended with September 17th. So this is what the caseload has looked like for positive school age. So at this time, it's very few numbers. And of course, this is the numbers that are reported to us, and that would even include any positive home tests that get reported to the public health nurses as well. So we're still keeping an eye on that. So we're very thankful that the numbers are low. We did have reports of a lot of kids out sick with other type of virus. And so the flu season will be starting soon. And so just be aware of that. And at this time, we don't have the flu vaccine available yet at Winslow Indian Healthcare Center. So just wanted to let you know that. Navajo Nation update. So Navajo Nation, for those of you who do not attend the school leadership meetings, they do happen twice a month. They're not weekly. So the next meeting is next Tuesday. And the latest update was that the percent positivity was 10% on Navajo Nation. The risk level is medium. Schools do not have to report to the portal anymore. And then Navajo Nation Safe Schools guidelines were updated. And many of you probably received that email from Department of Diné Education. If you did not receive that, you can request that from them and they can email it to you. But you can see that the numbers have trended down. So that's a good thing. But we still got to be mindful that COVID is still around and lingering. So when you look at Arizona as a whole, this is where you can see that in our whole state, because I know that with sports going on, we have our students traveling all over, all over the res. There's been volleyball tournaments, there's been football games, cross country meets, so they're all over traveling every. And some of the Navajo Nation schools have went ahead and moved forward with having fall sports as well, whereas they haven't had any sports in the past few months. So and looking at this, just showing you that the number of new cases reported since last week in Arizona was about 4,000, and new deaths by COVID was 82. And then new tests reported since last week. If you look at the bottom of the screen, 44,359. So people are still getting tested. People are still testing positive. So in Arizona, the whole state, the percent positivity is 12.6. So it's still there. Like Tyree said, when there's symptoms, it's best to get checked. A lot of people are utilizing home tests, and so and then just react and respond as you have on your protocol. So just wanted to share that with you. I believe that is it for that update. Tyree, you have the slide for the school health coordinator, or is that what you already shared?
Yeah, Luana, I already shared that.
Okay, all right, sounds good.
Okay.
So let me go ahead and go on to share the next item on the agenda. This is probably going to be a short meeting, so which is a good thing. I know everyone's busy. So here, the school health coordinator, here's Luana's contact information if you don't have it already. But she is moving forward with a lot of different things. This year, we have a school health task force. We meet regularly, and that includes myself. And I'm still keeping watch over like the COVID-19 and school health stuff. And then also with my other position is with youth wellness is diabetes prevention and childhood obesity. So, if you have any questions regarding those topics, let me know if you have any specific needs. And then we have our public health nursing in the task force, our mobile van coordinator, and also optometry and dental. So a lot of different people working together in this effort of school health and wellness. So, but she is our point of contact. Say you need specific things in your school, a specific presentation. she would be the one to contact, and then she'll point you in the right direction to the correct resource. I know someone reached out regarding stuff about lice. Another person that wanted a presentation having to do with tobacco prevention, so, but she is our point of contact. So I just wanted to share that with you. And it's nice to be able to get back into some in-person presentations. So we're very thankful for that. That's what we like to do, is educate and talk with families and kids. And the event last night at White Cone, there were 54 that came out, and that was a really good event. And so we're really thankful that different presenters came out. Someone from behavioral health was there, our nutrition team, and we were doing A1C screenings on parents. CHRs were even out there, so it's nice to get back to some of those activities. So let me move on to just update you on a change in our meetings. So beginning October 5th, these meetings, the COVID-19 school health meeting is going to change to just a regular school health meeting. It's not going to be just all focused on COVID-19. It's going to broaden in our focus to other areas of school health as well. We will continue to keep these meetings twice a month. It might change, it might become a monthly meeting. But we, at the meeting, will still provide the COVID-19 situation report, just so you're aware of what's going on with COVID. And it's going to be a collaborative effort. But we realize that there are a lot of school health and wellness areas of need that we weren't able to address or focus on or move forward on due to the COVID-19 pandemic. So we do want to help the schools in different areas of need. So just wanted to let you know that and update you on that, so that you're aware of the changes. And if there's any specific topic that you are wondering about and you would like us to provide a presentation or maybe have a special speaker, let us know, and we can work on that with you. So next thing, any questions to that before I move on to the next thing? Okay, I'm gonna stop sharing here. And then we want to go ahead and talk about this new booster. Tyree, can you share that screen, please? All right. So I'm not sure if you all have any questions or concerns, or maybe you have some comments, and this is a place where we can discuss with one another as our as a team and just partners, with all of the schools that are on as well. But we do have an updated COVID-19 booster. We could also call it, the Omicron booster. It's available here, and it is for those who 12 years and older can receive this, and it's what they call a bivalent vaccine. The former COVID-19 vaccines were monovalent, and so this one is bivalent. And so it is available. And so are there any questions about this vaccine from anybody? Wow, you guys are quiet today. So I'll just read through this flyer, and we do share this by email with you all so that you can print them and post them at your schools, because the encouragement too is that our schools help us with providing this updated information. So we would like and ask you to post this. It is it restores protection that has decreased since your last COVID vaccination. It provides improved protection against newer variants. And right now we're hearing about the Omicron subvariant BA4 and BA5 is what most of the country has been testing for. And so it's available to those 12 years and older who have completed the primary series and or any number of boosters. So the 6 months to 4-year-olds, they're still receiving the monovalent vaccine. So the bivalent is just right now is for those 12 years and older who have received the primary series already. So, but this is available, and from what I've read is that whenever the flu vaccine becomes available, and you come in to get your flu shot, you could get this booster at the same time as well, as long as it's been 2 months since you received the last booster. So just wanted to inform you of that. Are there any questions?
Sasha, this is Jerry. I have a question.
Okay, Jerry, go ahead.
So with this new booster, does it, who is the manufacturer, and does that matter if we received a Pfizer or Moderna previously?
Okay, good question. Good question. So the Moderna and Pfizer both have a bivalent. And so Moderna right now has emergency authorization for 18 years old and older to receive it. Pfizer is 12 years old and older. And from what I've read is you can receive either. If your primary series and your latest booster was Moderna, you could get Pfizer and vice versa.
Okay, thank you, Sasha.
Dr. Dorval, do you have anything to share regarding what you're seeing with COVID? Maybe as far as hospitalizations or severity with Omicron, maybe pertaining to kids, pediatrics. She may be with a patient. Okay, she's probably with a patient, so maybe we'll give her some time at the end to share what she's seen. But that's the update. Any other questions or comments before we move on to the next item? Okay. Going once, going twice. All righty. Tyree, go ahead and put up the other slide. And I have Lita Scott on, and I've asked her to go ahead and give us an update on monkeypox and what's the latest as far as what's going on within our area and on Navajo Nation.
Hi, good afternoon, everybody. So my name is Lita, for those of you who don't know me, Lita Scott. I'm the Division Director for the Community Health Services, and I'm also one of the co-leads for the Navajo Nation Health Command's operation. We have a unified group of leadership who we work with on a regular basis, and this started the first year of the pandemic in 2020. It was stood up within the first, I think, 3 months, where we established a unified command center through the Navajo Nation. All the healthcare facilities who provide services on the Navajo reservation to our target patient population are partners, and we have representations from the healthcare facilities, hospitals, and health centers across the Navajo Nation. We work in collaboration with the Navajo Division of Health and Indian Health Service as a 638 facility here. So regarding monkeypox, it was reported that this morning that we had 4 confirmed cases on the reservation. And the definition of cases for our with our command center is similar to the COVID definition, where they count a case on the reservation when they confirm that the individual does live on the reservation and they do receive care. Sometimes they live on the reservation, maybe, or they work away from off the reservation, but they have a homestead, but it's defined similar to the COVID case management that was established. So we do have 4 positive cases. And then the structure that that the group decided to use to mitigate and prevent the spread is similar to the COVID pandemic, where they're going to utilize the same unified command group. They're going to utilize the public health structures where there's team leads from the 638, IHS, and tribal who work together to establish, like we have a SOP for case management, contact tracing. We have an SOP for school age kids. So there is a draft SOP that's still in draft that hasn't been approved for monkeypox, but guidance has been given. The guidance is, and again, this came through very fast. And it was developed by our infectious disease team through IHS, and it was shared through webinars and community of practice huddles the past earlier, maybe a month ago. So we're at the point where we're looking at establishing an SOP. So we have an algorithm that was shared where there's 2 pathways. If a beneficiary accesses either the healthcare facility or one of the warm lines through the public health pathway, each access point is given information, education on how to triage or take information, and then rather than and guide the individuals to access the appropriate care. So there is a medical clinical pathway for exposure, for signs and symptoms, or an inquiry about the vaccine. And then as well as through the public health pathway, there's also anticipatory guidance on general information of what monkeypox is. And then even if a warm line team member receives a concern regarding signs and symptoms an individual is experiencing that are similar to what's being shared about the monkeypox signs and symptoms, or a exposure that they want to share, there's another pathway for our warm line team members. And this is 2 pathways because normally our warm line team members are public health technicians, and a lot of times they don't have a clinical license, but they are coached, and the information they share is script. So those are the 2 pathways that have been established. They're vaccines for the target group there who can receive vaccines. That information has been shared, and there's been a couple of educational sessions on who should receive the vaccines. And initially there was a tier that was shared, and now it's more available across Navajo. And then the reporting of cases, there's a process that's in place and a reporting template that's being utilized to give information back to our HCOC team members, as well as treatment also, and testing is also, there's recommendations that have given, and again, there is a draft SOP for monkeypox, and hopefully it will be finalized at the next meeting. Here at Winslow, we do have a warm line through our case management team, and that is shared here. It's the 289-1930 number, where and our team members have been trained. They did receive training regarding providing general information on monkeypox, and then they are informed about the referral process for those individuals who are reporting signs and symptoms, or an exposure, or any inquiries about the vaccine. That's another referral from the warm line to one is the respiratory triage for those who are symptomatic or who feel that they've been exposed. They are encouraged to go through that access point. And then we have an individual who started informing some of our target group who are qualified to receive the vaccines, and some of our beneficiaries have received, I think as of yesterday, we've given 17 initial vaccines, and they are two vaccines, two doses that are given 28 days apart. So that is my update, Sasha.
Thank you so much, Lita. I know there's a lot of curiosity, and different ones want to hear, what's going on, even close to us. So thank you for that. Are there any questions or comments? Now would be the time to ask or discuss. A few weeks back, I did share a handout that was from the CDC, and it was specific to teens and young adults and monkeypox. And so I just encourage you, just share that information. If it's in a handout, maybe to parents only or something like that. But it is important for us to just be aware of and mindful of, and so but here, that's the updates we have for you at this time. So if nobody has any questions regarding monkeypox or the update, we'll go ahead and move on to our next item, and we'll just have some announcements actually. I want to give this time to other programs who are on that might want to give an update on what they're doing with the schools, and maybe you want to invite them or get in contact with them as well. I see Arizona Health Zone. Rhonda, do you have anything to share?
Hi, Sasha. No, not at this time. Margene did reach out to the superintendents in our area, so if we can help out with their local wellness policy, helping to revise it or help put it in place, or anything that we could do, any service that we can provide for the schools. But other than that, we haven't heard back from anybody. So we're still having kind of a hard time getting into the schools, I think, because of,
Okay.
they're not still real open to outside visitors. So that's where we're at.
Okay. Thank you, Rhonda. Thank you, Rhonda. And as far as masks and stuff, our supply here, Winslownian Health, is limited to what we can give out to the community and the schools. We do have cloth masks, but I know maybe for some of the schools, certain supplies are running low, and there is a National Institutes of Health grant that was put forth, and I shared that with you by email, the application is due October 5th. So recommendation, if you're in need of certain supplies, it would be good to get a team together and submit that application. That would be good. You could get things like disinfectant wipes. You're needing to replenish mask, COVID home tests, things like that. And if you have any questions, just let us know how we can help as well. And then we do have Keanu. Keanu, do you have any updates as for the mobile van?
Right now for the mobile van, right now we're helping out with Sasha her childhood obesity. But next week on Monday, we'll be taking the mobile van out to Seba Delkai boarding school, and we'll be myself and the safety team will be distributing car seats
EVS or urgent
from the
care,
ages
EVS or urgent care, EVS or urgent
1 to 5. So we'll be doing that with Monday morning down in Seba Delkai. Other than that, just working with PH as well on strategizing for upcoming events. That's about it right now for the program.
All right, thank you. Thank you, Keanu. And also see Rod Antonon. Rod, do you have any updates for public health nursing?
Just touching on what you spoke about earlier, as far as some of the questions pertaining to lice infestation, and we did have a school with a challenge, but we were able to work together with the school nurse and administration to make sure that the treatments were distributed, and there'll be a follow-up to come. So I'm sure that we'll have other situations where something like this will be a concern elsewhere. But it's very important for the education part to not only do the treatment for the student, but of course to launder all the personal effects, including towels, bedding, clothes, toys, those kinds of things at the home. And usually if there's one family member affected, chances are there may be others affected as well. So we're trying to provide as broad information to mitigate this as we can. And so far, that's been our only public health concern with schools, but we're prepared to address whatever else should arise. And like you alluded to before with Lita's presentation with monkeypox, we're still in the forming stage as far as plans and so forth for putting out any additional information that may be a factor. So we're just available for anything else that there's a question on. My contact information has been shared, but I would encourage anybody to either call directly or email me if there's any other concerns that as we move forward into the school year, if something comes up, I invite any contact. Thank you.
Thank you, Rod. Thank you. Awesome. And we also have Jerry with Navajo Nation Health Education. Jerry, do you have any update?
As far as health education, we are starting to get back out into the communities, and I am available to provide any type of health education that may be needed in the schools. I will go ahead and post my information. And so if you need anything, any type of education, you can reach out to me. In the meantime, we are in the process of hiring a health educator, so she should be on board soon, I would say within the next 3 weeks. But other than that, we've been working on the monkeypox education, and this week we just went ahead and translated our monkeypox fact sheet into Navajo. And so we're just waiting approval to disseminate that information. And so that's what we've been working on, or I've been working on.
Nice.
Thank you.
That's great. Dr. Dorval, are you available? It seems she's probably busy. All righty, well, thank you for those of you who are from the schools. You're here and you're listening in. And it is recorded, so we will make sure we share the recording so that you can share that with others. Janelle, go ahead. I see your hand up.
Yeah, I just wanted to add one thing for the vaccine boosters. We do have, for the bivalent, we do have Moderna and Pfizer available here. And now, as of yesterday, we also have Novavax available.
So you have, you cut out a little bit. So you said you have Moderna and Pfizer and then Novavax. right?
Correct.
Okay,
That is correct.
all right. Thank you for that update.
Welcome.
Okay, if and nobody has questions or anything else to share, we will go ahead and adjourn our meeting at this time, and we'll go ahead and send the recording as well so that you can forward that to others as well that might have missed the meeting. And our next time we'll meet is October 5th. So thank you all for your time, and you all have a good day. Have a good rest of your week.
Bye, thank you.